A blessed good day to each and everyone. It is my privilege to present to you our research with the title Stress Management of Public Elementary School Teachers in Naic, Division of Cavite, Basis for a Wellness Program. I am Maria Concepcion L. Cabuhat, and together with me are my co-authors, Sir Raymond B. Jocson and Ma'am Jrilcind Kaye Calantog from Bukana Elementary School, Naic District, under SDO Cavite Province, Region 4A, Calabarzon.
Teaching is recognized as a highly stressful profession. Stress, if not managed, affects both personal and professional of the teachers. Inherent in the teaching though, effective stress management can transform the teacher's experience into a positive and rewarding contribution to the growth of individual learners and the larger society. The proposed wellness program is to improve employees' health and well-being, often through preventive care, which is presented in a matrix program with features of wellness component, objective, wellness strategy, action, person responsible, timeline, success indicator.
The review of literature and studies are relevant to the present study. They serve as guidelines and provided great help to the researchers' ideas and information on the level of stress and stress-reducing mechanism commonly utilized by public school teachers as basis for a wellness program.
The descriptive method of research was used to identify, analyze, and interpret the level of stress and stress-reducing mechanism commonly utilized by public school teachers in Naic, Division of Cavite. A survey was utilized to describe perceptions of members of a target population regarding a particular of coping up stress. Many researchers that surveys instruments have been found to be very effective at describing the characteristic of a population.
Table 1 presents the summary of the level of stress of the respondents. As presented in the data, all variables are rated very satisfactory. Overall, the level of stress of the teacher respondents were rated very stressful as supported by overall mean value of 3.72. Table 2 shows the summary of the significant relationship of the respondents. As reflected in the table, there is a significant relationship between age, sex, and number of years of the respondents and stress-reducing practices, and no significant relationship with educational attainment. Table 3 shows the stress-reducing practices among public school teachers. As shown in the table, 4 indicators were rated always. These are music, physical exercise, sleep, and breathing exercises. Table 4 shows acceptability of the proposed wellness program. As manifested in the data, all items were assessed acceptable.
Wellness is the state of good mental, physical, and emotional health. In implementing the wellness program, schools should be committed to empowering teachers to live healthy and active lives, and hope to be an integral to creating a healthy community in school. Likewise, workplace intervention and wellness program improve the safety, health, and well-being of employees. Based on the findings of the study, the following conclusions were drawn. Most of the respondents were 31 to 40 years old, female, rendering their service for 6 to 10 years and with master units. Number 2. The teacher respondents felt very stressful in terms of personal, occupation, organizational, and physical work environment. Number 3. There is a significant relationship between age, sex, and number of years in service, while there is no significant relationship in terms of educational attainment. Number 4. The respondents rated sometimes the stress-reducing practices. Number 5. The proposed wellness program aims to improve employees' health and well-being, to empower teachers to live healthy and active lives, and to brace them to be an active part of the integral driving force in creating a healthy community in schools. And number 6. The proposed wellness program is acceptable to the respondents. For the findings and conclusion that following were strongly recommended. Number 1, school head should maintain proper workload distribution to lessen the excessive tasks of teachers. Number 2, the study recommends using wellness program in assistance for stress tolerance of teachers. Number 3, stress management program per teacher should be conducted by specialized trainers. Number 4, teachers should manage their time well by proper planning and prioritizing work. Number 5. School heads and other school officials should sustain the development of teachers' competence to instruction, professional, and personal growth through training, seminars, and capacity enhancement activities for the upliftment of their performance. And number 6, the results of this study be published and disseminated to all concerned for information purposes and to elicit feedback.